Hey everyone, today we're diving into the world of newborn tummies. Specifically, we're talking about abdominal distension, a fancy way of saying a swollen belly. Now, a little belly bloat after a big feed is normal, but sometimes it can be a sign of something more serious. And that's where you, the amazing healthcare heroes, come in. Your keen eyes and quick thinking can make all the difference. We're going to break down some common causes of newborn abdominal distension, from the not so serious to those needing urgent attention. Think of it as detective work. We're going to equip you with the tools to crack the case of the swollen belly. So scrub in, grab your stethoscope, and get ready to become a newborn tummy whisperer. First, let's talk about some common causes. One of the most frequent is gas. Symptoms include fussiness, a hard belly, and frequent burping. Diagnosis is usually straightforward. A gentle press on the belly can reveal trapped gas. Initial steps for parents include burping the baby frequently and gentle tummy massages. Another cause is Hirschsprung's disease, where part of the bowel lacks nerve cells. Symptoms include severe constipation, a swollen belly, and vomiting. Diagnosis often involves a rectal biopsy to check for missing nerve cells. Initial steps include consulting a pediatric surgeon and preparing for possible surgery. Lastly, necrotizing enterocolitis, or NEC, is a serious condition where parts of the bowel undergo tissue death. Symptoms include a swollen belly, bloody stools, and lethargy. Diagnosis involves x-rays and blood tests to check for infection and bowel damage. Initial steps include stopping feeds, starting antibiotics, and possibly surgery. Remember, early detection and intervention are key. Your vigilance can save lives. So let's get started on this journey to becoming experts in newborn abdominal distension. Together, we can make a difference. Before we jump into the serious stuff, let's talk about how to assess a newborn's tummy. It's like checking the tires on your car. A quick inspection can prevent a major breakdown later. First up, visual inspection. Imagine you're a detective at a crime scene. You're looking for anything out of the ordinary. Is the belly bigger than usual, shiny or discolored? Are there any visible loops of bowel, like little sausage links, under the skin? Next, we palpate, which is a fancy word for gently feeling the tummy. You want to use a soft touch, like you're petting a kitten. Feel for any lumps, bumps, or areas of tenderness. Remember, babies can't tell us what's wrong, so these simple assessments are crucial. They're our window into what's going on inside that tiny tummy. Now let's talk about normal gas. It's common for newborns to have gas, which can cause some temporary discomfort. Symptoms include fussiness, crying, and a bloated belly. But these usually resolve on their own. However, if the distension is severe, persistent, or accompanied by other symptoms, it could indicate a more serious condition. Watch for signs like vomiting, especially green or yellow bile, which can be a red flag. Also, look out for bloody stools or a lack of bowel movements, which can signal an obstruction. If you notice any of these symptoms, seek medical attention immediately. Early intervention can make a big difference. Your healthcare provider can help determine if it's just gas or something more serious like NEC or Hirschsprung's disease. Remember, when in doubt, it's always best to get it checked out. Your baby's health is worth it. NEC, or necrotizing enterocolitis, is a serious condition that affects the intestines of premature babies. Imagine their tiny gut still developing, suddenly becoming inflamed, and sometimes even dying. It's like a fire alarm going off in their belly. Signs of NEC include a distended abdomen, often the first sign, bloody stools or diarrhea, feeding intolerance such as vomiting or refusing feeds, lethargy, and temperature instability. Nursing priorities involve early detection, which is key. Report any suspicious signs immediately. Stop all feeds to give the gut a break. Start IV fluids and antibiotics as ordered. Monitor vital signs closely. Think of yourselves as firefighters. You need to act fast to put out the fire in their tiny belly. The exact cause of NEC is not fully understood, but it is believed to be related to a combination of factors including prematurity, bacterial infection, and reduced blood flow to the intestines. Premature babies are particularly vulnerable due to their underdeveloped immune systems and gut. Symptoms can escalate quickly, making early detection and intervention crucial. Treatment typically involves stopping oral feedings, providing IV fluids and nutrition, and administering antibiotics to combat infection. In severe cases, surgery may be required to remove the damaged portion of the intestines. The role of the healthcare team is vital in monitoring and managing the condition to improve outcomes for these fragile infants. Support for the parents is also essential as they navigate this challenging time. Remember, early detection and prompt treatment can make all the difference in saving these tiny lives. Hirschsprung's disease is like a traffic jam in the intestines. Imagine a highway with no exits. That's what's happening inside the gut. Nerves that control the muscles responsible for pushing poop along are missing, causing a blockage. Signs of Hirschsprung's include delayed passage of meconium, which is the baby's first poop, vomiting often with green bile, abdominal distension, and constipation. As nurses, early detection is crucial. Be on the lookout for those red flags. Prepare the baby and family for surgery, which is often needed to remove the blocked section of bowel. Provide emotional support. It can be a scary time for families. You're like the traffic controllers in this situation, helping to clear the blockage and get things moving again. Hirschsprung's disease is often caused by genetic mutations. Symptoms can vary, but typically include severe constipation and a swollen belly. Diagnosis is usually confirmed through a combination of X-rays, rectal biopsy, and manometry. Treatment often involves surgery to remove the affected section of the intestine. Post-surgery, the baby will need close monitoring and follow-up care. Support groups and counseling can be beneficial for families coping with the diagnosis. Remember, early detection and intervention are key to managing Hirschsprung's disease effectively. Now, not every case of a distended belly is a medical emergency. Sometimes it's just good old-fashioned gas or a bit of feeding intolerance. Signs of gas include fussiness and crying, especially after feeds, pulling legs up to the chest, and passing gas. Phew. Signs of feeding intolerance include spitting up or vomiting after feeds, excessive gas, and fussiness during or after feeds. As nurses burp the baby frequently during and after feeds. Try different feeding positions. Upright is often helpful. If breastfeeding, mum might need to adjust her diet. In some cases, a change in formula might be necessary. Think of yourselves as tummy soothers, helping those little digestive systems find their groove. Parents can also help by gently massaging the baby's belly in a clockwise direction. A warm bath can also be soothing, and help relieve gas. Doing bicycle legs with the baby can help move gas along the digestive tract. Always hold the baby upright for at least 20 minutes after feeding to help with digestion. With these simple steps, you can help your baby feel more comfortable and reduce the chances of abdominal distension.